Okay, hello. So I'm going to be scanning our sleeping patient today named Tracy. We're going to be scanning her thyroid. So I'm just going to go over a couple things with you on what to set up for on your machine before you start actually scanning. So when we're doing anything that's superficial, we want to use our linear probe. So this is the 15 megahertz probe. This is going to be scanning anything that is very superficial. So the higher the frequency, the more superficial the area that we're going to be scanning. So we're going to be using this probe here. You want to make sure on your machine that you are selecting the appropriate transducer. So again, this is our 15 megahertz probe, and we want to make sure we're under the correct setting. So this is going to be our small part setting, and then we're going to be going to our thyroid setting. And it kind of just gives you, it sets you up for scanning this particular gland. So here, I'm just gonna make a couple adjustments. So this machine has a preset that is a little different than if you were to go anywhere else and use any other machine. Every machine is different. So I see that I have 3 focal zones right here. And on my machine, I'm gonna look at my focus and I'm gonna twist it to take away those focal zones. So now I only have 1 focal zone. I'm also, this machine isn't set up properly for the thyroid at times. So I'm gonna look at my frequency, it's 15, and I'm actually gonna lower it to about 12 megahertz. So that way it's gonna give me better penetration. Now, I'm gonna put gel on my probe and make sure that my notch is pointing to the patient's right. And I'm gonna be scanning the patient's right thyroid first. So the first thing that we're going to start with is their submandibular gland. So the submandibular gland is located right underneath the jaw, and that's where I'm going to start. I'm going to have my probe in transverse. So I'm going to put my probe here, and now on my screen, you can see, I'm just going to drop my depth and turn up my gain a little bit. This is a transverse right submandibular gland. So let me see if I can get a little bit of a better border. So this is the border of our submandibular gland. This is very, very homogeneous, and it is discrete. So when you're seeing the tissue surrounding it, so like this is fatty tissue, this is skin, and then we get down, and this is like muscle, this is more of our muscle, and then this is our submandibular gland. We're gonna put color on it to make sure that it has color flow. Sometimes you can see ducts that are in here. So this right here is a good vessel. Now, sometimes when you're scanning that submandibular gland, you're gonna see a duct. And how do we know if something is a duct versus a vessel? Well, we're gonna put color on it to clarify. If it fills up with color, we know that it's a vessel, and that's normal. If it doesn't fill up with color, then that would be a duct, and you would want to look further into that to make sure that there's nothing stuck inside of that duct. So now I'm going to keep my probe in transverse, and I'm going to scan down inferiorly. So now, as I'm scanning down, we see a couple of things in this picture. So now if we look at our patient, I'm about the very top of her neck, middle neck. So in transverse on our screen, we see a couple things. So this is our patient's right, and then this is our patient's left. I'm scanning the thyroid today. So this is our thyroid gland, okay? This kind of hypoechoic area, this is gonna be the patient's trachea. So the thyroid sits on either side of the trachea and has the isthmus that connects both sides, that is the bridge between two. Now, the thyroid is located in between the trachea and your vessels. So this right here is going to be our common carotid artery, and then even more laterally to that is going to be our anterior jugular vein. So we can see that those are our vessels. We can see them live. If I push just a little bit and I compress, I can see that this vessel is the one that's compressing and this one's staying strong. That's because this is our artery, it's nice and strong and healthy, and then this is our vein, which is more compressible. So now I'm gonna scan from superior to inferior, and I'm just scanning through that thyroid all the way down to make sure that I see everything. So this is going to be our supraclavicular area. So we want to scan underneath that clavicle. There are times where thyroid nodules, even though the thyroid is here, right? Our thyroid is here. There are sometimes nodules that can hang out underneath and connect to the very bottom of that thyroid gland. So we want to make sure that we're scanning all the way through. So I do a quick assessment from superior to inferior, and then I start focusing on my gland and taking my pictures. So I'm going to start superior. I take a couple pictures of the superior thyroid. And how do I know I'm at mid-thyroid? Right? So remember how we said that there's that isthmus, that's the bridge connecting the two sides. So this would be the patient's left gland, this would be the trachea, and the right gland, this is the isthmus. You know that you are at mid-thyroid when your thyroid is at its largest width, okay? Typically, it is where that isthmus is connecting the two glands. So if I scan up superiorly, we can kind of see that this is the right side, this is the left side, but there's no isthmus connecting it. That's because we're upper thyroid. If we go scan down more towards the middle, I would consider this to be our mid-thyroid picture. So we would take our measurement from here and straight across to here. That's how we're going to measure our gland in transverse. Now, we're also going to put color on our gland. That's very important. Now, what's wrong with this picture, right? Our color is a little flashy, right? It's a little all over the place. So I'm going to decrease my color gain, and look at how much that just cleared up just now, right? Much better, much prettier. That's the color picture that we're going to use, and we're going to have that on mid-thyroid. I'm going to scan inferiorly. I'm going to take a couple pictures there, and I'm again going to make sure I sweep all the way down to make sure that I'm covering that supraclavicular area and there's nothing hanging out down there. Now, watch my probe. I'm going to turn my probe from transverse to sagittal. So I'm going to turn clockwise, and now my probe is in sagittal. I'm going to look at my screen, and I see that I'm on my gland. So just because my probe is perfectly sagittal, that doesn't mean that that is our sagittal plane, because remember, we want to be sagittal to the organ that we're scanning, not to the body of the patient. So I'm just going to tweak my probe a little bit. So I'm going to move the top of my probe back and forth to get that perfect border. So if I'm here, I can see that I'm cutting off a little bit. If I bring it back, I can see the superior border of that thyroid gland. So now I have that locked and loaded. Now I'm going to go inferior, and I'm going to see where that border is. So now if I'm twisting my probe a little bit, I'm running into that vessel. So I'm going to come back, and I see that inferior border as well. So this would be a good place for us to take that. I'm just going to get a better inferior border. So we can see the borders of this thyroid gland. We see this is superior, and it goes down to here. It kind of goes up a little bit and down again, and we can follow that all the way down. We see that this is the inferior border of our thyroid. So our measurement would be sagittal and AP. Okay. Now, another thing to keep in mind is that some people have very large thyroid glands. Sometimes they're just enlarged with no nodules, and sometimes there's a bunch of nodules that make that thyroid gland look very, very big. So one thing that we can do to fix that is on our screen, there's this button called virtual convex. It's located in a different place for all machines, and it's called something different. Sometimes it's called wide view, widescreen. It has a different name, but on this one, it's called virtual convex. So if we hit that, look at our screen now. Do you recognize how it was different from this picture? See how this is going straight down? Our image itself is just a rectangle, a box, right? Now, if we use our virtual convex, see how that opens up? It gives us a wider view. superiorly and inferiorly if we're talking our sagittal view. So sometimes it's hard to see the entire gland for that. So that's the button that we would use to help us see the whole entire gland on one screen at once. I'm going to take that off because we don't need it, and you shouldn't use it if you don't need it, because it takes away from the quality of your image. So again, only using that when you need to. Now, I see that I'm on my thyroid gland. If I am in sagittal and I see this, and I see this, right? What is this that we're looking at? Well, this, if we're looking live, see it pulsating? That's a vessel. So remember, in our transverse view, our thyroid gland sits in between the vessel and the trachea. So in my sagittal view, I'm gonna take my probe and scan medially, running into that thyroid gland. If I scan all the way medially, do you see this kind of
railroad pattern?
Yes, railroad pattern right here, right? That would be the patient's trachea. That's the cartilage to their trachea. So I know that I am very medial. We do see thyroid tissue right here though, right? What would that be on top of the trachea? That would be the isthmus. So we're looking at the isthmus and sag right now sitting on top of the trachea. So we can also put color on our gland. Now we want to make sure that we adjust our box accordingly. So right now I'm just getting the center of the gland. I'm missing out on the lower portion and the upper portion. So I'm going to unfreeze and I'm going to reposition my box to make sure that it's covering the entire gland. And I'm going to freeze it. That would be an adequate picture for color on our thyroid gland. We don't want our box to be covering the entire screen. Look at how much artifact we're getting, right? We want to make sure that we are honing in on what we want instead of covering all bases, covering the entire screen, because we don't need that. So that would be our color image. So another thing we have to make sure we're sweeping all the way medially, all the way through the gland, and then all the way laterally, all the way out. We want to make sure that we're covering the entire thing. Now, we want to make sure that we get our midline view. So this is for the radiologist to compare both sides of the trachea. Now, a little bit of problem solving, right? So this is transverse midline thyroid. Do you see this right here? This is kind of like a hypoechoic with a hyperechoic ring on the inside, and it's located on the patient's left. So what do you think this would be? It's right next to the trachea, right? It looks like it could be in the thyroid, but it's actually not. This is not a thyroid nodule. This is the patient's esophagus. So if I go live and I ask Tracy to swallow, go ahead. See that? See how it just moved? So that's showing that that is the patient's esophagus and not a nodule. So it's all about problem solving while you're scanning live. Our pictures are proving to the radiologist that this is what we see. So we want to take our transverse midline picture. We want to make sure that we are encompassing the entire gland. So we have the entire left side and we have the entire right side. We don't have to have the vessels in the picture, although it is a reference point to make sure that we are in the same spot. We have our isthmus connecting the two sides as the bridge, and this would be a good transverse midline picture. We want to make sure that we get that picture with color as well. So again, we have to adjust our color box, and this is where your color box should be, okay? We also don't want to, we have to look at what we're taking a picture of too, okay? Now, we don't want to just take the first picture that we see, right? We want to make sure that we're assessing, like, okay, if I scan a little more superiorly, I'm getting more flow on that left side. If I scan a little more inferiorly, I'm getting that flow on the right side. When we're taking a picture, we're proving a point. So if I were to take this picture right here, what's wrong with this picture? We see that there's blood flow on the right side, but we see that there's no blood flow on the left. That would not be an accurate picture describing what we see, because I see that her thyroid is normal. I see that she has blood flow on both sides. So I want to make sure that I am proving that in my pictures. So this is showing that she has blood flow on the right and on the left, okay? So make sure that when you're taking your pictures, it's for a purpose. We can also get our isthmus measurement after we do our transverse midline shot. And I want to drop my depth, okay? When you're looking at your depth, you never wanna go less than 2.5 centimeters. That's just taking away from the quality of your image. After 2.5, if you need to zoom in, you can use your zoom button. And I'm gonna zoom in. We can see in the bottom left kind of thumbnail, this little box is what I'm focusing in on. So this isn't taking away from the quality of our image, it's just zooming in. So I'm gonna move my focus and I'm gonna measure my isthmus in transverse. Now, what you see here is thyroid tissue connected to the other side. However, you see this hyperechoic or echogenic ring right here. That is not part of the isthmus, that's part of the thyroid cartilage. So if you see this line, you wanna follow your border all the way across. So this would be our isthmus measurement from here to here, okay? And then you would do the same exact thing on the other side. So we would start at that submandibular gland, we would scan transversely all the way down on that left side, make sure we look all the way out, and then we would scan sagittally, and we would sweep medial to that trachea, and then laterally to that carotid artery. We would also make sure that we're checking our lateral neck. So this is transverse right neck. So we see our right thyroid, carotid IJV, and we're going lateral to that. We wanna make sure that we're looking in that lateral compartment to see if there are any abnormal lymph nodes. And we would do that transverse, and then we would also take a couple pictures sagittal as well. And on the same side, same thing on the contralateral side.